Hi, my name's Dr. Nick and I'm the Incrementalist. Revolution through evolution. This week I wanted to talk about the study that's just been published focusing on stent placement. It was really interesting. It's created a lot of discussion online and certainly lots of strong feelings about what is quite an extraordinary result that suggests that the placement of stent compared to a placebo does not reduce symptoms or exercise capabilities of those patients that were given the stent. What's interesting about this study is that in terms of the control group, what they did was they actually delivered a stent into 50% of the population through a catheter, but in the other 50%, they did the catheterization but didn't put the stent in. But aside from the people doing the procedure, everybody else was blinded to it, including the patients, the folks that were assessing. That's really quite an extraordinary control group. And whilst there's certainly been some commentary about the numbers, so we're talking 200 patients, there's a lot more stent procedures done in this country and around the world, that's still pretty significant because I think they've controlled for some of the challenges that we have in establishing whether something is effective or not. One of the challenges that we have is associated with the placebo effect. So it's well known that you can give somebody a sugar pill or a pill that contains no active ingredients and it can induce the same effects as a pill that actually contains active ingredients. That's known as the placebo effect. It's especially interesting because it doesn't just occur when you try and deceive people. It actually occurs if you tell somebody that it's a placebo. And we've seen over the course of the last 20 or so years, the placebo effect has actually increased in effectiveness. Lots of things to talk about here, but let's focus on the stent study and that discovery that suggests that maybe stents are not relieving symptoms or may not be indicated in many of these patients. Now, whilst you have to make individual decisions about your clinical treatment together with your doctor, your cardiologist, this does lend some really interesting insights that I think are important. And one of the things that I'm reminded of was the discovery back in around 1982-83 when the Australian physician suggested that stomach ulcers were caused by bacteria. At the time, I remember that there was almost a laughable reaction. We all had induced in our knowledge and understanding and really the sort of basic science of this that was an acid irritant to stomachs, and the idea that a bacteria could even survive in this really very acidic area of the stomach seemed really quite extraordinary. And the individuals that pushed that out really struggled to get their work and even the idea recognized. And in fact, they were laughed out in many instances. And yet, some years later, proven out, and sadly, that proven methodology and indeed treatment of ulcers with antibiotics that was recommended still didn't reach the population because there was still resistance and still lack of communication. So there's a big delay in our understanding from a scientific basis to when it actually gets actioned in medicine. But in this particular instance, when we talk about the stents, this may be the same thing, it may not, but it certainly reminds me of the challenge of confronting what is well-established scientific procedure and treatment. In the case of a stent, it makes sense. If you have a constricted coronary artery and we put a device in there that expands out and increases the blood flow, it would make sense just from a basic physics and a basic scientific basis that would actually induce a relief of symptoms and would be a good course of treatment. But this trial is suggesting otherwise. So what should you do? Well, I think you should assess all of those treatments on an ongoing basis with your physician. It's certainly something to watch. I'm sure it's going to be studied additionally, but it really raises the question that we always have with any treatment. Is it effective? And is it worth the risk that's associated with that treatment being delivered? You have to make up your own mind with your clinician, but this is interesting and exciting news that will help us improve the understanding of coronary artery disease and certainly its treatment. My name's Dr. Nick, and I'm the Incrementalist.